Good afternoon. I'm George Latimer, Westchester County Executive. Welcome to our Tuesday, January 19th update on the Westchester impacts from the coronavirus pandemic. I'm joined here, of course, by Deputy County Executive Ken Jenkins, and we also will have an opportunity for you to visit with a familiar face who is joining our county communications team today, and she'll be a little bit later in the program, Lisa Reyes, who you know from News 12. We have two major stories, both that we deal with COVID, that are both running in equal importance, and that is the distribution of vaccines and as well the extension of the infection of the pandemic. So how many positives we have and active cases and hospitalizations. The use of the concern of the vaccines coming out is really the answer to the pandemic that we're in. And we're trying to make sure that we vaccinate as many people as we can. That is the surest way to bring those numbers down, to have less people subject to catching the infection. And so we think it's important now for us to share vaccine numbers in the same way that we can share numbers that relate to the COVID infection advancement. So right now, we're still in the early stages of dealing with vaccine distribution under the rules of the state of New York, and we're also dealing with the current federal administration's ability to deliver vaccine product to the various states and then thereby to the various local governments across the board. Here in Westchester County, we have involvement as a county government in two direct areas of vaccine distribution. The first one, the largest of the two, is Westchester County Center, which opened on Wednesday as a major vaccination center in the county. And that facility, which has been set aside from its traditional use as a sporting arena and for various other large community meetings and gatherings, completely into a medical facility. It's been used in the past for antibody testing, and now it's being used for vaccinations. And that started as of this past Wednesday, it'll be a week tomorrow. And it's open from 8 o'clock in the morning to 7 o'clock at night. But you cannot get a vaccination there unless you have an appointment. And that appointment, which we'll remind you again in a few minutes, comes by registering on a state website. But I'm proud to say that after 6 complete days of vaccination, that site has vaccinated 6,459 individuals in Westchester County. That's over 1,000, almost 1,100 vaccinations a day. And that is going to operate 7 days a week, continually until we vaccinate everybody in Westchester County. It is by far from the only location that you can go to get a vaccination in Westchester County, but is the single largest ability that we have in order to try to vaccinate a significant portion of our population. We have also been given at various times allocations of doses of vaccines to our White Plains County Health Clinic, which is located on Court Street in downtown White Plains, county center being in the western edge of White Plains, right on the border of Greenburgh. So about a mile away in the heart of the business district is the county health clinic, and that clinic, which is by no means as large a facility, has been able to administer so far just under 2,000 vaccinations to individuals. So at 1,980 at the clinic, 6,459 at the county center. Westchester County government has been involved in vaccinating 8,439 individuals. As a percentage of Westchester population, it's a very small number, but we've gone from zero in the last 2 weeks, 3 weeks or so to this number, and that's only going to grow in the weeks to come. We have volunteers as well as health department officials administering the vaccines at the county center. All reports that we have is that the operation has moved fairly smoothly. The issues at hand are really in getting an appointment to be vaccinated, whether at the county center or any of the other locations, and that is a difficult challenge, which we'll allude to in a second. But we hope to hit the 10,000 mark in vaccinations by the end of the week, and we continue for that number to rise as we work through the population of Westchester County at those two resources. Now, as you know, we do not have a national vaccination program established by the current administration in Washington, which will be leaving office tomorrow at noon. The new administration is coming in setting goals very aggressively of vaccinating a significant portion of the American population, as much as a third of it, within the first certain number of days. Westchester County, as one small portion of that nation, is more than happy to do our share. And we look forward to the energy that will come out of Washington to really deal with this pandemic as a nationwide issue, not as a matter that each state does their own thing. Without the leadership at the federal level, the state has taken on that responsibility. Governor Cuomo, and of course, he's had his press conferences every day over the course of this time frame to convey additional information about vaccine distribution. And you've seen at the Javits Center in New York and Aqueduct in the borough of Queens and other places, vaccination centers. The county center is the state and county partnership that's happening here in our backyard, and we are looking for more areas to be able to do that with. We're still currently in phase 1A and 1B in the categories of vaccination, and those are still fairly small categories of individuals when you look at the population at large. We've identified in past updates that it deals with first responders, with health officials who interact with patients. We've gone through a long list of different occupations that warrant immediate vaccination. Those are still in play for the vaccinations that we give out. And it's been opened up now to all individuals that are 65 years of age and older and all that have a compromised immune system. So when you go online to the state website, there's a way for you to find out if you're eligible at the current day for vaccination. And you go on to the website connection, that's mieligible.covid19vaccine.health.ny.gov. I believe that's up on the screen. And the MI eligible will tell you if you're eligible given your age, given your health, as to whether or not you're entitled to be vaccinated right now. That cohort will grow, but it will grow as we receive additional vaccine from the federal government. We were working on the basis as a state of getting about 330,000 doses a week, and at that pace, it would take us well over a year to vaccinate every man, woman, and child in the state of New York. That number actually dropped in the last week as the federal supplies, we found out, did not have a stockpile. There's a host of different issues. That's above my pay grade. But for the things that I'm responsible for, as we have identified, as we receive vaccine doses from the state, our job is to make sure that they wind up in the arms of eligible individuals. Now, for those of you who fall outside of that criteria, we will wait for the state to announce on what date they will open it up to the next cohort of individuals. And that may be a universal cohort of everyone under 65. They may still make it age eligible. Perhaps, we don't know, and we'll all listen to what comes out of the governor's important announcements to determine how we go forward from here. But whenever that universe expands and you are eligible to make an appointment and you go on, we're hoping to have enough vaccine so that we can open up slots for vaccination at the county center or to the extent possible at our clinic. And I might add, in many of the other different locations, which include hospitals, it includes some pharmacies in the area, a number of other locations, outpatient locations. The act of giving the vaccine is a rather short situation. Like any flu shot you've been given or any other shot, it's a rather quick injection. There is an expectation that you will wait for 15 minutes after receiving the injection to see if your body has any particular reaction to the shot, and while you're under some medical observation, that hopefully if you do have the unique set of circumstances and you react negatively to it, that can be dealt with on the spot rather than going home and finding out that it's a problem. Most people, however, from anecdotally that I hear, people in my world that have gotten the shots, they do have some arm soreness, but no negative reactions. And a lot of the fear that exists out there, which it still does and will for a while, about taking the vaccine appears to have very few stories that back it up at this stage of the game. But we've got a long way to go to inoculate a wide number of Westchester residents. We hope to accomplish that mission. We hope to do it effectively as we go forward. The COVID hotline, and I have to look down to read the actual number to make sure that you're aware. If you're opening for scheduling vaccination appointments, you dial 1-833-NYS-4-VAX, V-A-X. The actual phone number, which I think, frankly, is a little easier to remember, is 833-697-4829. 1-833-697-4892. That is the hotline number that's available. And you must file a COVID vaccine form, and that's a separate place to go to, forms.ny.gov, and you'll see that on the screen there with the backslash and vaccine. You will get a submission ID, and that will trigger the information. We also have some information that you can find, a sort of a frequently asked questions document, which is called What You Need to Know, or What You Need Know. And that information is there on the screen, and I'm comfortable if our folks repeat those things in some sort of a cycling so that they can see it over the course of my presentation. It's as much or more important than anything I'm going to say that you know where you go to try to get these things. Now, the frustration is pretty clear for many people. The desire to get the vaccine as a means to protect you against this disease, which has taken lives, is tremendous. The supply of the vaccine is limited so far, and that is what's causing the bottlenecks. People will say, I call up, I can't get through. Or they'll say, I go on to a particular location, but they can't give me any appointments. The source of all of those frustrations come from the lack of available doses to be able to administer. You cannot make an appointment at a pharmacy or at a hospital or at the county center if we individually all aren't given the doses to administer on the particular date that you're looking for. And when you see somebody say that it won't be open until April, won't be open until May, that is on the basis of the commitments we have. If the new federal administration comes in, if they can work with the pharmaceutical companies to produce more product, to move that product around more quickly and more effectively into the various places where you can be vaccinated, then they will add available dates, and that will reduce the amount of wait that we face. And of course, as happy as we are that we've gotten the vaccination program started, we must repeat, every individual to be properly vaccinated must be vaccinated twice. And there's a 3 or 4 week lag time depending on which of the two current vaccines that you take, the Pfizer or the Moderna virus vaccine. And that means that our requirements are not merely to vaccinate every man, woman, and child once, but to vaccinate every man, woman, and child twice. And that creates an additional problem. When you are booking your appointment and you go in and you get your vaccine at that point in time, because it's triggered by time, then you'll need to make that appointment and honor that appointment for the second shot. And it's also very important to understand that to take the first shot alone does not protect you sufficiently against the COVID virus. You can get the COVID virus more easily if you only take one shot. You need the second shot, which is a booster that activates the antibodies created by the first shot. Now, I'm not a person of science. What I'm talking about is basic sort of common knowledge of how these things work. But whatever your fear factors are, whatever your concerns are, the two-shot step is a way to protect you against COVID. At the end of the day, that is what this is all about. We're not taking the vaccine for sport. We're taking the vaccine to limit the number of people that get COVID, so that in a few minutes when I go over some of the numbers and how much infection has been rising, that those numbers will flatten out and start to drop. People will not get even the more communicable strain of the virus if they have been inoculated against it. And that, of course, is why we have such a strong demand at the outset. However, we're also mindful that some percentage, I don't know if it's 20% of the population, might be higher, is hesitant or reticent to take the shot or unwilling to take the shots. And at this stage of the game, the demand for the 80% that wants the shots is so great and the supply is so limited, we're not really dealing yet with how we're going to deal with the last quadrant of individuals that don't want the shot. But for right now, we're trying to provide the capacity for those people that do want the shot and make sure that it's not just once, but it's twice, and both of those things are necessary. Now, there is some legitimate fear that surrounds the vaccine. Some of it is, expected. People naturally have concern. And since very few of us are comfortable with science or medicine, we react as people who don't know the specifics would, which is questioning and being unsure. We have with us by means of tape Dr. Dial Hewlett, who's one of our senior executives in our public health department, a doctor of great experience in this area. We have a video, and we'd like for you to share Dr. Hewlett's input.
My name is Dr. Dial Hewlett. I'm an infectious disease specialist, and I'm one of the medical directors for the Division of Disease Control here at the Westchester County Department of Health in White Plains, New York. I received the COVID vaccine 1 week ago because I'm very concerned about ending the pandemic, and the only way that we can really do that is to make sure that everyone has been immunized or vaccinated. The vaccine is going to be distributed in a very equitable way that has been outlined by the New York State Department of Health. Even after you have received the vaccine, it is important for us to continue to observe safe practices, including wearing a mask, social distancing, and avoiding large gatherings. We want you to be smart. We want you to stay safe. This is one of the ways in which we can end the current COVID pandemic.
Dr. Hewlett is the medical director for the Division of Disease Control for Westchester's Department of Health. And as you see, he said that the risk to one's health and the risk to the society is far greater if you avoid the vaccination than by getting inoculated, even though there is reservations by a sizable number of the population. This is the tool we have to combat COVID. There is no other tool available. If we fail to get inoculated, we are as susceptible to the disease as we have ever been throughout the course of this infection. And I am going to take the time to tell a quick personal story. This story goes back about 20 some odd years. I was out in a public setting at twilight, speaking with somebody in the parking lot. Your meeting is over. You're out talking by the car, and I had something rustle me at my head, and I pushed it away. The person opposite me said, "That was a bat that was on your head." And I looked to see if there was any residue, if I was bleeding or anything of that nature. And I said, "I don't think the bat bit me or anything. What do I know?" So the next day, I called the Department of Health, and the people in the Department of Health at that time said, "You need to come in and talk with us." So I came in to talk with them, and I said, "Look, the bat didn't bite me. There's no sign of any blood or puncture of the skin." And they said, "Well, the bat can convey, rabies, which is the great disease that to be concerned about, could portray it through saliva, and you wouldn't know if you've been infected." And I said, "Well, what could possibly happen?" And basically the doctor laid out 4 possible outcomes. If I did not have rabies and I didn't take the shots, I'd be fine. If I did not have rabies and I took the shots, I'd be fine. If I did have rabies and I took the shots, I'd be fine. But in that 4th option, I had rabies and I didn't take the shot. Death was assured in a fairly short period of time, and a rather painful death it was. Why would I take the chance of my life? Because I didn't want to have the shots. At that point in time, there was about 6 to 8 shots that were required to the first day, and then alternate weeks after that, and then a final flurry of shots. It took me 6 weeks to complete all of the shots that I had to take. Actually, they actually gave me a cooler with the shots that I left, this kind of thing you'd put beer or soda in when you're going to the beach. And I had to go through the discipline of taking the shots every period of time. And, they were shots. They weren't, they weren't fun. They weren't terrible. But I made it a point to take all the shots. I did not get rabies. I'm standing here 22 years later, perfectly healthy, rather than having suffered. Maybe I never had rabies. Maybe the bat didn't interact with me. But why would I take the chance? My life would have been on the line if I had guessed wrong. So why take the chance of guessing wrong? What percentage is there in it for you if you guess wrong? There's no percentage if you contract COVID, and of course COVID is proven to be fatal at some level of concern that we see in Westchester County. So from my own experience, I did not like getting those shots. I'm happy that I've not had any further incidents with bats, but I also hope to have no incidents with COVID either, and I hope you feel the same way as relates to what Dr. Hewlett has said and what we've all said. One more point to make, then I'm going to ask Ken Jenkins to come up and talk about a section of our concerns. There's a lot of discussion about the UK strain or the UK variant in the COVID virus, and there's been much discussion about it. It was identified within the last month or so in England, and it was determined to be a more communicable form of the disease, but it was not determined to be a more dangerous form of the disease or a more fatal form of the disease. And that's very important. When we hear that there was a case in northern Westchester of the new UK virus strain, there was a fear, oh my God, this is worse. Will the vaccines deal with this the same way they would with the main strain? And as we've been told by the medical professionals very clearly, that this does not change the intensity of the disease, but it does make it more communicable. More of a reason to wear the mask, more of a reason to sanitize, more of a reason for social distancing. There's been contact tracing underway with the individual case in northern Westchester. We're looking, obviously, to see if there is a greater spread. Sometimes a greater spread happens. You may remember well over 6 months ago, there was a group of people got together in Chappaqua at a high school event, and a number of cases generated out of that. It seems in retrospect a quaint number when we had 20 or 25 cases, none of which turned into any fatalities. Now when we're having 700 some odd cases a night routinely. But then we had a situation in late August where there were 2 priests within a Catholic parish that contracted the disease, but because they took the proper precautions, no other member of the congregation got the disease. So when you hear about the UK strain, that mutation of the virus, do not assume that this is something worse that can't be dealt with by the vaccines that are out there. We're told by medical science that this is manageable and will be something that can work through properly as we go forward. Now, there's a number of different things that we're working on, and one of the target audiences for this is the one that we've dealt with for so many months in this particular issue because of the high level of death that's come to those who are seniors. So I want Ken Jenkins to talk a little bit about our outreach and our programs to seniors as it relates to the pandemic.
Thanks, George. As County Executive Latimer just pointed out, especially in the time when we moved from 1A to 1B in the vaccination process, and the state opened up that process to now include people that were 65 and older to be able to get the shots, we understood that there was a special challenge for our people that are seniors in Westchester County. And the Department of Senior Programs and Services has been instrumental in working together with our folks that are in our senior population to be able to navigate the stream of trying to get through to get vaccinated and to schedule the appointments for vaccination. So the number for Department of Senior Programs and Services is 914-813-6300, and that's on the screen. And again, that is not, they're helping to navigate through the process. They're not making an appointment for you. They're helping people navigate through the process of making an appointment on the state website, or whether they're trying to get through on the phone lines. Many times, because 7 million people are eligible in the 1B category, that the lines have gotten messages back that say that they're call back later on. The lines are just burned up busy. But many of our individual seniors have no way of getting on a website and navigating through that process. So the Department of Senior Programs and Services has partnered with many agencies that the county already works with to help assist our senior population in getting through and navigating this kind of arduous process. Keeping in mind, again, that as County Executive Latimer pointed out, if you don't have an appointment, you just can't just show up at the door of a retail location, a pharmacy, or the county center, the county health center, or any of the other places. You need to have an appointment. You need to fill out some of the paperwork ahead of time. And sometimes if you can't do that, there's ability to do that right at the location. But again, we just want to keep echoing that you need an appointment to be able to get vaccinated. But the Department of Senior Programs and Services under Commissioner May Carpenter, and certainly directed by County Executive George Latimer, that making sure that we're assisting our population, our senior population, as best as possible. And once again, that number is 914-813-6300. Thanks a lot.
Thank you, Ken. Okay, I do want to touch on the numbers and the extent of the infection. We have data as of yesterday. As of 2 o'clock today, the New York State tracker had not yet been updated. But through yesterday, we had a total of 84,420 individuals year to date that have tested positive for COVID in Westchester County. 72,762 of those individuals have been 2 weeks or more in duration, meaning that the active number, the people that have been infected within the last 2 weeks, is 11,658. That number of active cases is as high as it has been since the very first week in April. And we are approaching the peak number of active cases, which we had in March, which was slightly over 12,000 cases. Now, that number has oscillated just a little bit over the last number of days. If you go back to a week ago, that number was 11,146, but it had gone down a little bit and then back up a little bit. 2 weeks ago, that number was 9,389 active cases. That was right after the 4th of July, the New Year's Day weekend, January 4th. So in the space of 2 weeks, we've had an increase of 2,300 active cases. That is a sign of the growth and the expansion of the disease. Now, we are right now about at just past the 2-week mark from New Year's Eve, and we had posited that Thanksgiving, Christmas, and New Year's Eve would be times in which people would get together informally. They would not get together in a public setting, but they would in a private setting, and that would potentially expand the number of cases. And that has proven to be true so far. It may also be affected by this strain that is more communicable. So when you go back, a few weeks, if you go back to a point a month ago in December, on December 18th, which would be a week before Christmas, we'll look at what the numbers were. We had 8,641 active cases. Today we have 11,658 active cases. That is significant. The last statistic that we have on hospitalizations come from Sunday, where 513 individuals were hospitalized. That is actually an encouraging number because we hit a peak earlier in the week of 554 individuals hospitalized. And obviously hospitalizations, people get well and leave, and then new people check into the hospital. So those numbers are net situations, not necessarily the same number of people. At 513 people hospitalized, that number is actually below what it was the week before that and above the week 2 weeks before that. So we're hoping that what we're watching is the beginning of a downslope in hospitalizations. That would be very encouraging news. And over the course of time, we hope that that downslope will also include total active cases, meaning less people are being scored as active. And we'll see each day what the statistics bring. Today, the active numbers will come up again today, and we'll see how that number compares. The numbers I'm giving you for active cases as of yesterday, and the number of hospitalizations are as of Sunday. In terms of fatalities, we've lost just under 1,800 people to COVID, 1,797 individuals. Over the prior week, we lost 61 individuals to COVID in the week prior, from yesterday to the week before yesterday. And if you go back slightly before that, the number is over 100 individuals, 114 individuals in the last 2 weeks. That is a significant death ratio from what we had throughout most of this pandemic after we peaked out. During the peak period of time, we had a horrific set of circumstances. As we started to drop down in fatalities and hospitalizations, the numbers dropped very low, but these are serious numbers. And again, the race here is about how fast we can get enough vaccine in as many people's arms to protect them from getting the infection and thereby avoiding hospitalization and death. And it will take time until there's a significant number of Westchester residents, a significant number of Americans that are vaccinated against this. But as we're looking at it, the numbers are rising. We are encouraged that the hospitalization numbers haven't risen. They've actually dipped a little bit, but you don't want to make too much of a trend if it's only a week or 10 days. You want to look and see it over an extended period of time, and you hope that that will show that all those things are in place. We will be back to give these numbers again in 2 days, but in the meantime, as you know, we've set up a dashboard the last couple of weeks, which has some of these numbers available that you'll be able to see. We're also hoping to add to the dashboard vaccination numbers so that you'll be able to look in a moment's notice, see how many people are vaccinated as much as we can. Now, we do not get the vaccination numbers, nor do we get the hospitalization numbers, nor do we get the death numbers broken down by municipality. All of those numbers are trackable through the state, and the state has to release it to us. We've been through this before. We provide as much of that dashboard as we have access to, and if we get access to additional information, we'll provide additional information. It is not as complete as individuals would want it to be, but it gives us, it shares with you the information that we have access to, that we're trying our best to highlight for it. But you know, we're hopeful that as we go forward, these numbers will be better, and that will give us something positive to talk about. Let me just address briefly, tomorrow is Inauguration Day in Washington. It is the inauguration of our 46th President of the United States, Joe Biden. The first inauguration that I ever remember seeing as a little boy was 60 years ago, the inauguration of John F. Kennedy. And over those years, the inaugurations of every other American president, the tragedy of the assassination of President Kennedy and the swearing in of Lyndon Johnson, the resignation of Richard Nixon, and the swearing in of Gerald Ford being the only exceptions to it, every inauguration is a time of hope. And I say this sincerely, not because of President-elect Biden coming into office, but we look to this point in time forward as Americans, not as Democrats and not as Republicans. When Donald Trump came into office 4 years ago, the hope and the expectations he would be a successful president. However, he has been assessed subsequently. The same hope existed for Barack Obama. The same hope existed for George W. Bush, for Bill Clinton, for George H.W. Bush, and Ronald Reagan, and Jimmy Carter. In every one of these cases, we are Americans, and we want to see, I think all of us want to see the most possible effective government out of Washington. We've talked many times about what we can do in Westchester County as being contingent upon what happens in Washington. Fighting this pandemic is contingent upon how well organized Washington, D.C. is, and we hope that President Biden will be able to direct the country effectively. We know that there's been a threat of violence. We saw violence 2 weeks ago. in entering the halls of the House of Representatives and Senate by people who had violent intent, and 6 people died because of that. We know that right now Washington is making sure that there's a completely secure perimeter. The totality of American government will be on that podium tomorrow for the inauguration. That makes us both open and free and transparent and as vulnerable as you can imagine. And I hope that we all remember that this American democracy has as its bedrock free elections and the transfer of power peaceably from one administration to the other. And I've seen administrations from Republican to Democrat, Democrat to Republican, in the past, a peaceful transition of power. I've seen a warmth of spirit even between people that competed against each other. When Gerald Ford lost to Jimmy Carter, when Jimmy Carter lost to Ronald Reagan, when George Bush lost to Bill Clinton, and the change of administrations when a vice president lost to a future president. And in every one of those cases, there was a generosity of spirit, and there was a sense of unity. And that unity comes from mutual respect, from the way we treat each other as individuals. There are legitimate differences in our philosophies. Those differences are praised because that is what we as a democracy can do. We can disagree and stay within a civil engagement, but there are concerns that people will try to break up that civic engagement tomorrow in Washington or in our state capitals or perhaps even here in our county offices. The county is prepared to deal with whatever might happen tomorrow. We believe that that the vast majority of Westchester residents, the vast majority of New York residents, and the vast majority of Americans want to move forward peacefully, want to see us address the problems that we have. If violence or unrest should come to our door, we'll deal with it effectively, and we want you to have the confidence that we're not afraid to meet whatever challenges come before us, and we meet them calmly and within a sense of normalcy and within a sense of effectiveness. That has to be our commitment to you, all of us in public office, that we will give you the safe and secure society that you can then prosper and grow in, and you can pursue your individual ideas and your missions. I do want to end on a very upbeat note, and we'll go to questions, I guess, will be the final way that we'll end. But I wanted to make sure that I introduced a familiar face to you, have her come to the microphone, say a few words of greeting. We have tried in this administration very hard to reach out and bring people into this administration that we think bring skills and talents that add to the quality of our ability to deal with the public. You might take note that when I first took office, I was a member of one party and I took over from another party, but I did not fire all the chief leaders of the departments that served under the prior administration. In fact, we kept most of those individuals on because we wanted some continuity, and we felt that most of those individuals were professionals who were trying to do the best job they could, and we made changes where we thought changes were merited, and we brought people in. I take a backseat to no one in terms of trying to make sure that we have the best possible person and to reflect the diversity of America, but not to do it cynically, not to do it in order to check a box, to know that we have people who are talented in and of themselves, and they happen to have different life experiences. There are different ages, different sexual identities, genders, different racial, religious beliefs, but we are all Americans, and we bring those people on board when the circumstances allow us to, when their career path and our career opportunity mesh. And this is one of those moments. Lisa Reyes is an outstanding reporter for News 12. We know how aggressively News 12 covers county government, and it's an important part of the media outlets, and Lisa was one of those prominent faces on News 12. Now we're happy to have her with us as communications manager. I don't know if she's come over to the dark side or how that actually works. But whatever it is, Lisa Reyes, we're happy to have you with us. And your fans are out there in the audience. Please come back and say a quick hello. I'll go this way. You go that way.
I need the stare. Thank you so much, Mr. Latimer. Thank you. This is such an amazing opportunity, and I'm very much looking forward to being here in Westchester. This is such an important, critical time to disseminate information that is critical to our daily lives. So again, very grateful for this opportunity and to be here in Westchester. Estoy muy agradecida de esta oportunidad aquí en el condado de Westchester. Espero trabajar con la comunidad latina y toda la comunidad aquí in Westchester. I'm very excited to be a part of the communications team here in Westchester and to work alongside everyone here in county government to serve all of the people here in Westchester. So thank you very much, and stay well, everyone.
Thank you, Lisa. Thank you very much, Lisa. The one thing I can promise you is when a snowstorm comes, we're not going to put you out there in the middle of it with a cameraman and the wind and the snow and the rising waters. We're not going to do that. We'll find a way for you to do your job in a safe and secure environment. So I always marvel at the folks, most of whom I get to know in the media, whether we agree or disagree on a particular moment, the reporters that have to go out and cover disasters up close and personal in the middle of the night. For all of the glamour that all of your friends must think it is, it's probably just as much difficult work. None of that here. We'll have other kinds of crises, but not the kind that I've just described. So we're very happy to have Lisa Ray with us. She's working in the department led by the great Catherine Chaffee, who herself was an on-air reporter for WCBS 880 Radio, and also continuing with Joe Scamato and Carolyn Fortino, who will be back after maternity leave. She has a beautiful baby girl to add to our family. And when Carolyn is back, we'll be happy to have her here. We'll even see if the baby wants to come on camera, make her first appearance. But, we have a lot of work to do. It's serious work, and Lisa's skill set will help us communicate well and fairly and honestly. And I'll say one more thing, too, and it's very important because I've watched this at other levels of government. When we have discussions internally, Ken and myself as the leaders at the top of the pyramid, as public, officials who run for office, our operations team, our communications team, we make sure that the people in our team say what they think. We don't stifle dissent within. We try our very best to listen to alternate points of view so that the policy or how we project that policy through communication is not really a handful of us deciding and everybody else having to fall in line. And we have adjusted both our policies and our means of communication based on input. And Lisa comes in the door along with Catherine and her other colleagues with the freedom to be able to speak truth to power and to be able to help us shape that message. So people should understand that. That may be something that I assert and you might not believe it. Whether you believe it or not, it happens to be the truth. And over time, you'll see that that kind of independent thinking is what has helped us tackle so many things in these 3 years successfully. It doesn't come from one man sitting in a corner office. It comes from all of us together working as a team, and I'm very glad to have her on the team. We've mentioned before when Blanca Lopez was promoted, we intend to bring Chris Steers on board. He's over at the county center right now supervising how that operation is going. Chris, a very talented guy. I want to make sure we introduce him to you here, and we'll do that for so many other people that we bring on board. So with that, Catherine, do we have any questions out there from the press?
We do. We have quite a few questions. The first two questions come from Barrett Seaman from the Hudson Independent. The first question is, what is the county's current level of support, if any, for COVID testing in schools within yellow zones like Terrytown, Sleepy Hollow?
Well, we've made a commitment, Barrett, to all of the school districts. We have a weekly call. We didn't have one this week because of the school holiday. But we made a commitment to all the school districts that the testing that's required under yellow zone, or for that matter, orange or red zone designations, should they occur. There's one orange zone in the county in Portchester. Should there be a red zone, that we will make sure that we can access the testing product, the Binex cards product from the state, so that the school districts will have sufficient means to be able to test the population as necessary. Every school district's in a different place. Some are remote, some are hybrid. There's some, I assume, that are in school with the certain parameters of social distancing and so forth. And we know that the school districts themselves are going to have a very difficult time accessing the test kits alone. And there's 44 in Westchester County, I assume something to the tune of 800 across the state, maybe more. And we can't have school districts whose primary function is education competing to get a necessary resource. So the county has stepped in to be helpful to those districts as much as we can. The particular school districts that you may be reporting on in the river towns, certainly if there are any that are having some issues and difficulties, we'll try to work with them. We have redirected much of our energies around vaccine distribution over the last couple of weeks because that is the program that has to get organized and steadfast. But we're committed to school testing, and for that matter, testing across the board, PPEs and so forth across the board with whatever entity needs it.
His next question is, have you been getting complaints about the registration system for vaccines? Recognizing that this is a system run by the state, not the county, I wonder if the county's offering Albany advice about the design of the online registration system or offering any assistance to eligible Westchester residents having trouble making appointments.
Well, first of all, you're correct in pointing out that the systems that we're operating under are state-created and state managed. I've made that point time and time again, not to shift blame, but to focus on where change has to come from. And when there's an effort made to reform or to change a policy or a procedure, that decision is possible at the state level, and we do our best to advocate for that change. And there are examples of that happening. The change in the testing policies in schools for orange and red zone districts came because we, amongst other entities, lobbied the state executive branch to be able to make some changes. We think that happened as well when we looked at some of the protocols for how long you have to quarantine after a negative test and how long you have to quarantine or stay isolated after a positive test. So we've tried to do that lobbying. I've always found that when you're within governmental structures, your best bet in trying to influence policy is to do it directly with the decision maker. There's this perception that you're not fighting hard enough if you don't go to the public and you shout out in public on the decision makers. Sometimes that works. Sometimes that makes the decision maker harden their existing position. And what we want is the result, not the showtime attention for having advocated for things. So you don't always see our advocacy in these things publicly. Every so often, you'll have a rally for restaurateurs in Portchester, or schools that want to make sure they have school sports this spring, and we'll add our voice to them. But our contact and lobbying more often than not comes in contacting those people that are in the highest levels of the state administration, that have the greatest access to the ear of the decision makers, and to try to influence the policy in those areas. Now, in terms of helping, Ken just mentioned what our efforts are for seniors to try to help them navigate the existing system. And it's a difficult system. I've gone online to do it. You have to have a certain comfort level with technology. And for many of us, it may seem pretty simple, but for folks, there are many folks out there, and particularly seniors, that don't have computers, aren't comfortable with computers, or may have reached an age in their life where they just need assistance to see, to know what it is that they're being asked to comment on, and unsure of themselves. And so to the extent that we can do that through our county Department of Senior Services, and also we had a conference call 2 weeks ago with the various local senior directors from the various recreation programs in all the municipalities. And I've had a chance to visit many of them over the course of my career. And those senior directors are turned to by the local seniors, help me do this. And so that kind of assistance and help is one example. I assume this is Barrett who asked this question as well. That's one example, Barrett, of how we've tried to be helpful in that. I think we have commented on the design. There are lots of different ways to make things better. We've tried to input where we can. And sometimes there are reasons for things that we don't necessarily know. Westchester is one part of a very large and diverse state. And the things that often happen statewide happen for reasons that may not affect us in Westchester. So we have to give our input, but also recognize there's other input coming from other places as well. I think at this stage of the game, the state is committing to do whatever it takes to get the job done. They're going to show, as they have already, I think, some flexibility. More flexibility is welcomed. You began the question with that people come up to me complaining. Yes, all the time. We have a demand that far exceeds the supply, and the ability for people to easily get the appointment, go on, click, 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 get the appointment is just not easy. I compare it to what we had when we had online census registration. I did the online census registration myself. Took me less than 10 minutes. Couldn't have been easier. This, not so easy, because there are certain decisions you have to make when you look at the different places that you might get your shot, how wide a radius, and then you start to look and click on specific things and how you interact with them. So I do think that there's room for complaining, but I would say that the complaints have dropped dramatically over the last 10 days. When the program was first initiated, there was a lot of frustration with it. But now I think as we start to roll, as we start to do 1,000, 1,100 people a day at the county center, as a percentage, that's not a lot yet, but it's showing a lot of people are getting through the system and getting through it better. So I think the experience is going to get better as we go along. The key question is, do we have enough doses to give out? That is the overarching question. Somebody might say, well, what are you going to do about parking at the county center? Okay, we made it free parking. What are you going to do about how many lines? We can deal with lines. We get the product, people will get the appointments, and they will get the vaccine, and we'll be through this.
Okay. The next question comes from Tara Rosenblum from News 12. Trying to get some advice for people who've had problems accessing a second appointment after they got the first. What should they do? And County Executive, what's your message to providers not scheduling second appointments as state protocol dictates they should?
Well, I think, we'll do the second question first. Any provider that is not prepared to do the second appointment, we need to know about that, and we need to bring that to the attention of the state. As I just said a few minutes ago, without the second shot, the first shot is not fully effective. You must have the second shot. And if there is some hesitancy for whatever the reasons are, then that has to be brought to the attention. If it is lack of ability to commit to the access to doses, then we'll have to resolve that issue. But the second appointment has to follow by so many weeks, and you can't go into a situation where you've got the first shot and now you're open-ended about when the second shot comes. It has to follow a certain amount of time. For specific situations like that, we will do whatever we can do to try to make sure that we bring that to the attention of the officials that can correct it. Look, I think on the front end, Tara, we're dealing with, and I know this is a very generic way to respond to the question, we're dealing with an issue that's got so many different dead alleys and trap doors that we're trying to work our way through. And each time, we hear an anecdotal circumstance, it is complicated in some way that the last anecdotal circumstance was not complicated. And all we can do is to try to work through this particular set of circumstances, and then when the next person contacts us, deal with those set of circumstances. And we understand that, a lot of folks can't even get through on the line. So we try to get better every day, and it's an imperfect system. The royal we, the county, the state, we have never had mass inoculation since the early 50s in the polio vaccine. It was a different America then. And you've got, people who go on social media and they share their unhappiness with the world, and it creates a mindset that everything is coming unloose, when in fact we're trying to work through these problems and solve them to the best of our ability. If there are specific cases, and we know that you turn to Tara from News 12 for any of these kind of solutions, if we can be helpful in solving the individual problems, we're happy to try to do that. You're welcome to reach out to us here in our offices through Catherine, and we'll try to get those answers solved if we can.
Okay, great. Next question also is from Tara. We're hearing from vaccine seekers who are telling us that they were turned down due to previous cancer diagnosis. Have you heard anything about that?
I have not. I don't know if we've heard anything specific about that. We'll check that through our health department. But because a person has a prior diagnosis of having fought off cancer, they've been denied getting the shots. If that's the question, we'll try to get an answer for it and respond back. I don't know if there are certain categories of individuals that would be denied categorically, and if that is, those would be a state decision to do that based on medical science. I can't imagine it would be done any other way, happenstantially, so we'll have to find out. It's not a decision that comes at our level, so we'll have to find out.
Okay. The next question is also from Tara. What are your thoughts on Westchester residents heading to Florida to get vaccinated?
Well, this is the problem when you don't have a national vaccination program. And let's be candid, you didn't have a national program to inform everybody about the pandemic when it started. You didn't have a national program for testing. You didn't have a national program to determine what types of things should be shut down and what types of things should be open. So 50 states make 50 different sets of decisions. And some folks will go to Florida. Florida has a different style of administration. I can't say specifically for Florida, but when I've seen some of the reports I've seen on national television, some states have more of a first-come, first-serve attitude. And it allows you to get in just by dint of persistence. But one of the problems that bakes into the cake, and I'll tie it back to one of the questions before when we talked about senior citizens, you get a person who's 35-year-old and tech savvy, and you say first come and first serve, that 35-year-old knows how to use the system to get in, to get a vaccine. The 78-year-old person that is not computer savvy does not know how to get in, and the 78-year-old person needs the vaccine more. So if I'm 35 years old and I have a place in Florida, or my parents do, or I know somebody that does, and I don't want to wait online in New York, I want my vaccine now. You go to Florida, I'm assuming Florida is much more wide open, you get it. I'm worried about the 78-year-old person here in New York that can't get it, not the 35-year-old person who's healthy. And obviously, if they can get it through some other means, by all means. I don't begrudge them the right to get it in another state. But as a matter of public policy, we have to focus on the people that need it the most right now. And so if different states are practicing different policies, we can't control that. That has to be part of a national program. Obviously, the ship has left the dock without a national program, and so Florida will do what Florida does. I've lived in 3 other states in my life, and I've worked in 2 other states in addition to the 3 that I've lived in. So I've had some exposure to 6 states, and I know that every state does it differently. Every state has its own political realities, its own geography, its own topography and demography, and so I can't say that you wouldn't be better off in North Dakota, where they have less people than they have in Westchester County. And maybe in North Dakota, you can get a shot. Now, this time of the year in North Dakota, not a place you probably want to be. But every state is different, and every state will have a different strategy. So if a person can get a shot and it's done legally by the laws that apply in that area, then it's fine with me. If they're going to skip line illegally, that I have a problem with. And so I think right now where we are in New York is 65 and older, compromised immunity system, special categories of work. Those people should get shots right now. I'm technically now in that group because I'm over 65, but I don't feel the need to jump ahead of the line if there are people that need it more because they're younger, but they're in compromised health situations. I certainly have gone 10 months waiting to get to this point with the pandemic, and I've been out in the community more than once, and I will take my chances that social distancing, mask wearing will keep me COVID-free. And I think if people are rational and patient, we'll get through this.
Okay. The next question from Tara. Are you noticing in terms of populations in our county not signing up for vaccinations compared to other parts of the county? Do you have the data broken down by zip code or municipality?
We don't have the data broken down because the people who have not yet gotten the vaccine fall into any number of different categories. Where the categories we do know are the demographic of age, 65 and older, and we also know by the type of work they do. So we can't yet judge whether people who fit into a certain demographic category are refusing to take the vaccine because it may not be opened up to a wide enough group of Westchester residents yet to draw that judgment. We do know that we have heard anecdotally that in communities of color, there is more reticence to take the vaccine. And I think the 2 things that we have to do to try to deal with that, number one, is we have to have credible spokespeople who can relate to the individuals from those communities so that they see medical professionals, doctors, nurses, prominent people in their communities, church leaders and municipal leaders who are in the same demographic category as they are, taking the vaccine and showing that they have no fear over doing this. I think the more people that get vaccinated, the more that concern is going to drop because you're going to have friends who've been vaccinated and no side effects, and they're fine and they do well, and ultimately, hopefully, they don't get the disease. I think that will help. That's one thing. The second thing we need to do is make sure that our vaccination locations are available in all of the corners of the county. Now, that's exactly what we had to do with testing. If you remember, we started testing. We had a drive-in at Glen Island. You had the Westchester Medical Center drive-in. Those were the first 2 places you could get tested. But over time, it got to the point where in the Neighborhood Health Center in Mount Vernon, in a church in downtown Portchester, churches and health clinics in Yonkers, once you started pushing that out into the neighborhoods of the county, particularly the poor neighborhoods, particularly the neighborhoods where people of color live, you got a higher percentage of people who are going to be tested. We're going to have to do the same thing with vaccines. We can't expect people, many of whom don't have a car, to get into a car and come to White Plains to get the vaccine. We're going to have to try to make it as accessible as possible in the areas that they live. I'm sorry? No, go ahead.
No, the 2 town halls that you have coming up this
Well,
week.
that's right. Well, we have, that's right. And the state has established some locations for vaccination in certain locations that are around various churches. Calvary Baptist Church here in White Plains is going to be one of those locations. There's, as Ken was saying, some town hall opportunities that we're going to have to discuss as well. But I think, Tara, the important thing here is that we can deal with a large portion of the objection. At the end of the day, it's still an individual decision. And we want to try to make sure that the individual who has questions that drive that decision can have those questions answered. And hopefully any objections they have can be overcome.
The next question comes from Lauren from WABC TV. Thoughts on Portchester kids getting back to school after 2 months of being only remote? Is the county executive hopeful? And does this show that with testing, schools can continue?
Well, I think it's a very difficult process because, the schools, and these decisions have been made by each individual school district and school boards. There's been a lot of controversy in Community A, Community B of whether they should be remote or hybrid or in-room and so forth. But I think we all understand that when children are in class, they get the best possible results of education. They're in a position where the teacher can interact with them face to face. The teacher can convey the class lessons better that way. They can see the children's degree of absorption of that. And in a room of peers is a lot better than when they're home, and with all sort of varying, circumstances when you're home. But on the other side of the coin, the fear was that if you have everybody in the classroom, you would expand the disease and people would get the disease and it could be fatal. And it could be fatal to youngsters, or even though it's more likely to affect adults. So I'm encouraged when schools remain open. I'm encouraged that the testing will show, hopefully, that the level of infection remains below a serious level, and that more children can make more progress in their grade studies. This is very difficult. We're almost one full year into this, and we lost that last portion of the academic year last year, and we've lost quite a bit of substance in this year's situation. And you worry about where individual kids are going to be. An 11th grader going on to 12th grade is one thing. A second grader and a third grader, their minds are expanding quickly as they grow, and they build their knowledge of mathematics by doing addition and then subtraction, multiplication and division, and then fractions, then algebra, and one builds on the next. And if you're missing building blocks along the way, it's going to slow down that natural process. And the teachers who were trained to teach were never trained to teach with Zoom or WebEx. They were trained to teach in in-class settings. So yes, I'm encouraged when kids can be in class, as long as it can be done in a healthy and safe fashion.
And the last question comes from Samantha Crawford. She asks, the governor sent a letter to Pfizer's CEO yesterday asking if New York State can buy doses of their vaccine directly from them. Today, Rockland County Executive Ed Day also sent Pfizer a letter requesting that the county receive their fair share based on population. Do you plan on sending a letter like this? What are your thoughts on the idea of New York purchasing directly from the pharmaceutical company?
Well, no, I don't expect to send a letter to Pfizer. Pfizer can't possibly deal with 62 separate counties in New York State, another 22 counties in New Jersey, 8 counties in Connecticut, and on and on and on. That's an impossibility for a corporation to deal with. I don't think it's productive for me to send a letter like that. I think I've just read that Pfizer came back to the governor and rejected the buying of it from a state. And so there's only 50 states, New York's a big state, but Pfizer rejected selling it individually. Look, we're trying to get around a basic fact. The basic fact is the federal government, as of this moment today, has failed in being able to have a national vaccine distribution plan. They were too busy worrying about other things. The time and energy and effort that should have been focused on this issue was misdirected in other ways. And I'm not trying to be partisan, but I am speaking absolutely factually in this case. And I reject any point of view that's the opposite of what I've just said. If a national government brought the 50 governors together and said, here's how we're going to handle it, here's what the protocol is going to be, here's how we're going to get it shipped out, not here's your allocation, whatever you do, you do. That's not how you lead a nation. You wind up with people saying, hey, I'm going to fly to Florida and get it there because in New York or Rhode Island, they have a different format. This is insanity. This is not how you operate. And I can only tell you from a county level of government, when we make certain decisions, we're on a phone call with all the different local governments. And there are governments that are run by Republicans, governments that are run by Democrats. We try to find common ground, and we try to find that common ground without referencing our respective partisanship. And we make progress doing it that way. That's what's missing now. So for me to write a letter to Pfizer, aside from the fact if they're going to reject the state, they're certainly going to flick the Westchester County executive away. It requires the federal government, with the power that the federal government has, to deal with these major pharmaceutical companies, to come up with a game plan by which product will be produced, paid for, and disseminated. And I might add, it's the federal government that regulates these entities. So if the federal government, through the Food and Drug Administration, authorizes these products when they're ready, and the corporations deal with the federal government has leverage with these individuals. There's no leverage within the county of Westchester any more there is in the village of Buchanan writing to Pfizer. So I think the correct answer is demand more of your federal administration. You have a new federal administration starting tomorrow. I can't expect on Thursday or Friday things are going to happen in the first 2 days in office, but I do expect that over time that federal administration will take this seriously. They'll work through the problems that we've had up to now, and we'll see some appreciable improvement. Not because of partisan reasons, but because you've got to get product in the arms of people to inoculate them so they don't get the disease, so that we move out of the pandemic, we can restore the economy, and we can start to try to have a normal life. We say goodbye to the masks. You know, we can greet each other warmly when we see each other, the things that we want as Americans, but we can do it safely. And we could do it intelligently. And that's why what's most offensive about all of this is it didn't have to be this way. It didn't have to be this way. And hopefully it won't be this way as we go forward. Are there any other questions?
Nope, that's all.
Very good. You've all been very indulgent for the hour plus that we've had this update. Thank you for your time. Thank you for Lisa Reyes. Welcome aboard. And Ken Jenkins, always my partner in all of this. Catherine Chaffee, thank you. And we're very appreciative to our friends Dave and Phil. I guess we keep them nameless, right? For their work in setting all of this up. We'll be back on Thursday to report on where we are at that point in time. Hopefully we'll have continued good numbers on the vaccine side, and hopefully we'll see a little backward movement on the infection side of the equation. And whatever else we have to report, we will do so on Thursday at 2 o'clock. I'm George Latimer, County Executive. Thank you for watching, and we'll see you soon.